Hey guys, I wanted to do a video on neck pain and jaw pain today. One of the biggest things that will happen is I'll be seeing a patient, I'll know their body really well by now. We're getting better at getting their pain under control. They're starting to feel like they can do more. But then we start to see this pattern happen where it's like this one spot just keeps coming back, keeps coming back, keeps coming back. And those kind of things, I just have to kind of always stop and ask myself, what is going on? Have I missed something? Have I checked above the problem area? Have I checked below the problem area? So it's funny because so many few times people's pain, the cause of the pain, located exactly where the pain is. So a good example of pain being located exactly where the cause of the pain is like a bruise. So like, boom. Ow, oh my gosh, it hurts so bad. It's bruised right there. And you press on it. That's sure enough, that's the cause of the pain. You hit your elbow right there. It's bruised. It hurts right there. But something that's a little different is, for instance, this pain that's in my neck right here, in the side of my neck, it just won't quit. And we adjust it and it feels better for a little while, but then it comes back. So what could be some kind of underlying problems that could be going on with that? So on my list is check the shoulders, check the posture, make sure those are pulled back. Check the sacrum and the pelvis, make sure that that's loosened up, make sure that we've got the body balanced in muscles from right to left, front to back, and top to bottom. And then, of course, check the cranium, check the bones of the head. So your head actually is made of tons of different bones, but they fuse when you're growing up, and they fuse pretty early, thank goodness, right? Because if you've ever, it'd be pretty bad if your bones of your skull weren't fused. But where they are fused, there's also a little tiny bit of give and sometimes some tenderness located right over where the different parts of the skull fuse as well. They're called sutures, so there's some that come across the front here, there's one down the middle, and there's some on the sides. And so oftentimes you can check the cranium or the skull for just it's less of a bone being stuck or restricted in any way, and it's more of like a tight fascial or connective tissue. So the way I like to describe it is the connective tissue in your body is kind of like saran wrap. It goes and covers all of your organs, your muscles, it covers everything, and it kind of intertwines throughout the body. In somebody who has a cranial distortion pattern or restriction in their skull, it's more like the saran wrap is just a little tight and it's pulling. So it feels a little bit more like that. So it's not as not going to be the same or make a noise like some of the rest of the areas in the spine do, which is either satisfying if you're me, or fun if you're some of my patients, or terrifying if you're my others, but everyone feels way better after it happens. So that's the key. And so I'm going to go into jaw pain a little bit. So speaking of the cranium or the skull, some of the bones make up your jaw. So that is your maxilla and your mandible, and they are down here. Obviously, this part's going to open and close a little more. I'm probably gonna make a bunch of weird faces, so forgive me. And if you want to just put your fingers on your jaw, how can you tell, first of all, if you have jaw pain? First, you can analyze your jaw in the mirror. You can put your fingers here, just lightly, right in front of your ears, and just feel an open and close really slowly. Open and close. And you can even see on me, my mouth kind of takes like a curve that way and back. And so if one side kind of deviates a little bit, doesn't go straight up and down, watch once more. It feels like I'm going straight up and down. So if it deviates a little bit and doesn't stay in the midline or in the center, you might have some jaw issues. If you've got tenderness as you're feeling over the jaw muscles here, then you might have some jaw problems. And then also if you get a lot of like popping in the ears, if you pull on your ears a little bit and get some tenderness, you may have jaw problems. If you get pain up under here, under your skull a lot, you may have jaw problems. So tenderness in the teeth or numbness, those kind of things can all be related, not just to jaw. And you might think, well, I grind my teeth at night, but I didn't think it was a big deal. but I do have neck pain too. I wonder if those are related. And most of the time they really are. So the muscles that connect to your jaw connect in and around. They connect down here to your bones. They connect back here. I mean, they kind of go every which way. So they could very easily pull something off a little bit, or be constantly pulling some of your vertebra off to the side. And a good chiropractor will look up at the top, up down at the bottom, right where your pain is, and try to uncover some of those causes. What I will say is this is not the kind of approach that people take if they are if they're like coming to the chiropractor when they have pain, they want their pain to be gone, and then they leave and they come back when they have pain again. That's okay. You can hang out in that area of the chiropractic, and it's almost like an urgent care. Like when you need it, you go. That's kind of how our medical system is. But many patients who we really take a lot of time with, and we get down to the bottom of these underlying causes, are the ones that do a care plan and sort of complete their first X amount of visits a little more frequently and start to slowly spread them out and continue on sort of a maintenance and a preventative basis. People who opt for that kind of chiropractic care, typically we can get a little bit deeper into like something, I'm seeing a recurring pattern here. What could be related to this? So that's usually where we're gonna see some of this. So yes, your jaw pain can be very related. Quick personal testimonial, and I will try to keep this to about 10 to 15 seconds, is I actually had some dental work done on my left side and had some pain and trouble chewing on that side for a long time. So then I chewed only on the right side for about 4 or 5 years. Being a poor chiropractic student, like I was in med school. So I was just trying to get through, and I kind of let that slip. And so now I have gotten it repaired, and as I'm chewing on this side again, I'm getting like headaches and pain in different areas, and it reminded me, you know, probably not everyone would know that this is very related to the jaw. And it actually felt like my head was screwed on too tight, and I've gotten a lot of different treatments done. I've even noticed that my smile has tilted. It goes higher up on this right side, which I have used a lot more, and it doesn't quite really function the same way. So this is my right. That does. I don't know. I can't make myself do it, but basically one side of my face doesn't work as well. So get weird with yourself. Look in your bathroom mirror. Make weird faces. Open and close your jaw, and see if you notice anything. Once you're doing some of this and you're noticing a pattern, I would highly recommend making an appointment with someone to have them check it out too. So a chiropractor, maybe your dentist might have a little bit of input about this, or be able to refer you to a chiropractor they work with, or a massage therapist who does some jaw work and has good training, maybe even a craniosacral therapist, which can be a PT, a massage therapist, a chiropractor. So that's a specific technique that might help with this a lot. But one of the best things you can do is, for your neck pain in general, move your head in each direction every day. So look all the way down. Don't just look down like this. Try to touch your chin to your chest. Really look till you feel a stretch back here. And then look all the way up. Look all the way right. Don't do this. Keep your shoulders down. Look all the way left. Tilt. With this one, I see people going like this a lot. Keep your nose to the front. Stare at yourself in the mirror. Keep your nose to the front. Tilt the head. Then you can reach the opposite arm towards the floor. Keep your nose to the front. Tilt your head. No rotating. That's cheating. So move your neck around. Another thing is you can pull on your ears a little bit. Just pull straight outwards. Grab your earlobes. You don't have to pull very hard. So maybe 5 pounds pressure, 10 pounds pressure. If it feels better to pull harder, by all means, you can give yourself a nice little tug. But if you pull and then you open and close the mouth, jut the chin forward. Good. Open and close, jut forward. Open and close, jut forward. Good. And then go side to side. I look so silly. I don't even care. I hope it helps someone. Look right and left. And that can help loosen the jaw up too. Also pressing down on your own teeth if you open the mouth up. Pressing down, pressing up. And noticing if that doesn't seem to help a little bit. So a couple quick stretches you can do. Yes, your pain's probably related. Yes, I would love to take a look at it and help you today be out of pain. I don't know, it's like my Monday today. I'm back from the holiday. I'm feeling great. I hope you guys had a wonderful Memorial Day and long weekend. And if you have any questions, drop them below. Leave us a comment, say hi, share with a friend. You can make a huge impact in somebody's life who might otherwise have been dealing with debilitating jaw and neck pain. So hope you have a great day. Bye.